For more analysis on this, let's bring in Dr. Yipeng Ge from the Canadian capital, Ottawa. He is a physician. Dr. Ge, 800 people killed while trying to access aid since May. It's hard to imagine a more cruel statistic, and there have been plenty in the last 21 months.
You know, human rights organizations and humanitarian organizations have been warning the world, the international community, Western countries that are complicit in Israel's genocide and ongoing blockade and siege amounting to a famine of an entire population, have been warning for weeks about these crimes against humanity, these war crimes, this form of genocidal colonial violence that is happening through the distribution of scarce amounts of food aid. Provided by the Gaza Humanitarian Foundation, which is a misnomer because they're not humanitarian in their own delivery of the aid, not by principle, not by practice. It's being led by American mercenaries, coordinated with the Israelis, and we're seeing hundreds of people be massacred at these aid sites, with thousands more injured.
And Dr. Ge, of course, this was warned of, wasn't it? Human rights organizations, UN officials said that the GHF model was dangerous and unlawful. I mean, this week we saw a deal signed between Israel and the EU to better allow humanitarian aid in. Do you think that is going to change things?
Until we see, I think, meaningful action by member states, countries around the world that actually have an obligation to prevent and punish genocide, in using all of the diplomatic and political levers that they have at their disposal, including sanctions, including arms embargoes, including suspending free trade with Israel. Until we see these bare minimum pieces be done by the states that are most complicit in this genocide, in this ongoing genocidal campaign against the Palestinian people, until we see these things actually be put in place, this is the bare minimum that needs to take place. We cannot see an endless humanitarian aid sector continue to dismantle an existing healthcare system in Palestine that should be led by Palestinians, that should be sovereign, that should be self-determined, that should be led by the people, for the people. But what Israel continues to do is actually destroy that entire healthcare sector and the humanitarian sector